Hello, welcome to the Better Outcomes Show, where we explore the possibilities of a new healthcare. Each episode, we bring you a conversation with leaders across the healthcare industry, exploring topics ranging from new treatment techniques and interventions to novel service delivery methods and business models. And now your host, Rafi Salazar from Rehab Practice Solutions, a leader in patient engagement and retention strategy. Let's explore the possibilities of a new healthcare.
Well, hello again. Welcome to another episode of the Better Outcomes Show. I'm your host, Rafi Salazar from Rehab Practice Solutions, where we fill clinics and healthcare organizations with engaged clients who value the treatment and the services that you, as a healthcare providers, provide. If you want to learn more about what we do and how we do it, you can head on over to www.rehabpracticesolutions.com. That's rehab, the letter U, practicesolutions.com. Little update for everybody. I know I've mentioned it before that I'm working on this book project, or I've been working on this book project for the last year or so. It takes a little while longer than you initially expect when you start off on one of these projects. But I just heard back from the publisher this week. In fact, they sent me the timeline for production and all that for the book, and I'm pleased to announce that Better Outcomes, a Guide for Humanizing Healthcare, that's the title of the book, Better Outcomes, a Guide for Humanizing Healthcare, will be available and on the proverbial shelves or the Amazon checkout screen. At the end of this year, it'll be in the first week of October of 2022. So look for Better Outcomes, a Guide to Humanizing Healthcare in October of 2022. From the back cover, I'm going to read a tad bit here. So we have a problem in healthcare, obviously. That problem is that in today's healthcare environment, especially in the United States, people take a backseat to the numbers in almost every aspect of healthcare service delivery. So productivity, utilization, and other business metrics rule the roost when it comes to decision making. If it's not calculatable, spreadsheetable, or measurable, it hardly receives any attention from the healthcare managers, administrators, and ultimate decision makers. As clinicians, we can't simply sit back and allow the dehumanization that currently runs rampant in our clinics and hospitals to continue to wreak havoc on one of the most important factors in clinical outcomes, and that's the relationship between healthcare professionals and the people or the patients that they serve. Healthcare is a great and noble profession, but it will only remain so if we as healthcare professionals return the focus to its true purpose, people, the people receiving care and the people working to deliver that care. After all, we're more than simply numbers on spreadsheets or items on a checklist. Better Outcomes, a Guide for Humanizing Healthcare, outlines the 8 changes that organizations and clinicians need to commit to in order to refocus healthcare to where it should be, the patient. This book covers topics related to truly patient-centered care. We cover biopsychosocial approach to service delivery, patient engagement, interpersonal communication, and developing long-term relationships with clients and patients. Through an exploration of both clinical research and real-life clinical examples and cases, the book outlines and supports a vision of a new healthcare where skilled, competent, and caring clinicians care for engaged patients to promote better outcomes, deliver unmatched satisfaction, and build meaningful and lasting relationships. So if that book sounds like something that you'd be interested in reading, you can head on over to the website, rehabilitation.com, click on the tab for books. You can sign up. We'll be doing a couple book giveaways as we get closer to October. And yeah, excited to let that one out into the world. So what do we have on the docket this week? This week, we're taking a step back into innovation, technology, and the business of delivering healthcare services, particularly how we can use tech tools, apps, and platforms to connect patients or people and providers across the globe, specifically when it comes to traveling in a foreign country and a foreign state. So my guest this week, Jenny DeFleur, she's the co-founder and CEO of a company called Air Doctor. So she spent more than 20 years working for Intel. She shares a little bit about her past history working for the Intel Corporation and kind of some of the microprocessors that she was working on. And she was the general manager of its manufacturing facility in Israel. And before that, she had various engineering and manufacturing roles within Silicon Valley. So she comes from like the tech space. And she says that in the conversation that she's not really from healthcare, but she had a lot of the tech understanding and how do we get the logistics and apps and APIs and all those things that are like way over my head as a clinician. But she helped found Air Doctor, and Air Doctor is her second startup. It previously founded an electric vehicle company that was called Electrode. But Air Doctor is an app that connects local clinicians to travelers across the globe. So let's say you are traveling to Italy for that wonderful romantic vacation with your special someone, and you come down with something that is, messing your vacation up. Instead of doing what many people do, which is, they go to the hospital, they don't know what's going on, they're going to go to the hospital, get it taken care of, which can be very costly and time consuming. An app like Air Doctor connects you to a local clinician or clinic, primarily independent clinicians in your area that might speak the language that you speak, that has already negotiated a cash-based or a private pay rate so that if you are safe in the United States going to Italy, you can pay that, get an itemized invoice and submit that to your insurance company for reimbursement. Or if you're like me, you're on a healthcare share or a health share platform, you just get the itemized statement and you send that into your health share, right? So they try to do a lot of kind of the legwork of finding good quality clinicians, connecting them to patients in the area, and then handling a lot of the administrative stuff so that you can just worry about what you should be worrying about, which is your vacation, right? So that you can, if you get sick, you use the app, you find a clinician, you go in, you get a prescription, you get whatever it is, you get it taken care of, and you don't have to sit and wait forever in a hospital waiting room somewhere. And one of the things that she said in the interview, which made a lot of sense, is there are tons of clinicians across the globe who might be really, really good at their job. They might be really good clinicians, top-level clinicians, but they don't market to tourists, right? It's probably not worth it to them to market to tourists, just given the other constraints they've got in their business. But they would be just as effective, if not more effective and more cost-effective for sure, than that tourist or that person going to a hospital. So they really try to cut the cost of healthcare down by decreasing the number of people that would go to an emergency room or go to a foreign hospital, which saves the insurance company the money, right? If they happen to be insured by a third-party payer like a commercial insurance company, it saves the person a lot of time because they're not having to sit in a hospital and wait overnight and be admitted and all that kind of stuff, all that rigmarole. And it helps the local clinician who's really good at their job keep on treating patients, right? And keep on treating people. So it's a really interesting concept. Hopefully you find it as interesting a topic as I did. So without further ado, here is Jenny DeFleur talking about Air Doctor. Well, hey, Jenny, welcome to the show. How are you?
I am fine. Thank you, Rafi. Happy to be here.
Yeah, I'm looking forward to talking with you about Air Doctor and how it all works. But before we dive into that, tell us a little about you, yourself, your work, and kind of what led you to this project.
Okay, that is interesting because I'm not coming originally from the healthcare business. I come from the semiconductors industry. I worked many years, 21 years for Intel Corporation. And I went through a lot of different positions. I ended in a very senior executive position. So I was 4 years living in California working for Intel, and then I moved to Israel to start a new manufacturing facility in Israel, where eventually I became the general manager. It was a big operation, around 3,000 people. So I got the experience of managing big operations with a large budget. but mostly of working international. At Inter, you work with people from all over the world very closely, with Irish people, with people in Japan, in China. So I had the knowledge and experience of being globally in my activities. And when I left Intel, I moved to the startup world. I worked for a startup first, and then I created a startup. This is my second one, Air Doctor. So that's about me. We are 4 partners that coming from different arenas. One of them is the one that came with the idea of Air Doctor. And maybe that's something that can be interesting for the audience. And
yeah, because how did you make the pivot from working in Intel to, all right, I'm going to do this healthcare tech startup thing?
Well, I tell you what, I always, in my personality, I love to start things from scratch and build them. And I am a builder by character. And I did it at Intel, and Intel let me do it. That was great for me because was, working in many different places. But when Jan, is one of the founders, came with this idea, I said, how is that we don't have this till now? And almost everybody, said the same thing. How is that it didn't happen before you? I mean, it's really no one else did it before. So it's very, very, because it's very obvious, it's very simple, it's very needed. Okay, so I tell you what is the
I was about to say
what we do. Okay, this is I created the opening. He was actually my partner. He was sick when he was traveling in Mexico, and he doesn't speak Spanish. And he was sick like many of us when traveling. Suddenly you are sick. It's not a major serious things that you need to go to a hospital, but you are really in need of a doctor. He didn't know where to go. And he ended asking in the reception of the hotel, and they say, okay, look, there is a hospital here and there. You can go to that hospital. So he went to the hospital. He waited for 6 hours. In a place that, very scary to be when you don't know the language or, the culture. And the doctor treated him. He didn't really understood what the doctor said or what was the problem. And he was very frustrated. And he said to himself, look, if I need a restaurant, or if I want to eat a hamburger in Mexico, in Cancun or wherever, I just open my phone, I open the web, and I look for a hamburger place or restaurant, and I get whatever I want with cheese, without cheese, with onion, with and if I need a doctor, which is pretty basic, you cannot find because you don't know where. Now, usually you call, if you have an insurance, a travel insurance, you call your insurance, the assistants, and they will tell you, look, mostly they work with hospitals, or they tell you, go to a doctor, send the invoices, and we will reimburse you. But they don't have a network. I give you an example that happened to me as a woman. I needed a gynecologist in Hungary, okay? So how do I know? I'm a specialist. It's even worse because a GP, someone can recommend to you. But if you need a specialist, if you need a pediatrician for your child, you are in a worse situation even. So we say why there is, and we started to research. There are no applications or not website or anything that will offer to connect me to local doctors, local doctors from the community. And that's the way we started. We started with a prototype. We started to recruit doctors mostly in Europe. Now you will ask why Europe, right? We started in Europe because at that time, it was 2018, was 1.4 billion travelers worldwide a year. But half of them, like 675 million, were traveling within Europe, or people coming to Europe. So we say, okay, let's start where we have the majority of the travelers. And also there is the geographical connection. We are close to Europe. And we started with Greece. We went to recruit doctors ourselves. We were by ourselves with my partner. We were going through recommendations. We have the director of one big hospital in Israel that was our advisor. And he actually trained us how to connect to doctors, how to talk, how to check them, and so on. And we started to build a network with personal connections with doctors in all the travelers, where the travelers go usually, the tourist locations, travelers locations. We've created a prototype. One of the insurance companies in our area wanted to work with us. They say, okay, someone called me. I don't want to tell them, look, and we give you the reimbursement. Usually it's outpatient, so it's not so expensive bill or ticket. So they prefer to do it even cashless. So actually, and now I get to our solution. We have two types of customers. If you are coming by yourself, you just found us in Google and you download the application or you go to our website, you will find all the doctors around you. And we will say, Rafi, these are the doctors around you. What do you need? Do you need a GP? Do you need a dentist? Do you need orthopedic doctors? You will choose what specialty you need. We will show you around you. We say, okay, if you are sitting in New York or you are sitting in Lima, Peru, these are the doctors around you, but we will give you information. This doctor speaks 3 languages. Maybe he speaks your language. If you speak French, okay, there is a doctor that speaks French. We will tell you what is the distance from where you are. We will tell you where the doctors study. We will show you the CV. We will show you pictures of the clinics or of the surrounding, and we will allow you to book an appointment. And so within 45 minutes, you can book an appointment with the doctor. And then 2 things may happen. If you are coming, you're a B2C, what we call a B2C customer, directly to us, you will pay through the application to the doctor after the visit. We pay the doctor and you get the receipt, the invoice to be reimbursed. If you're coming through one of the insurance companies we work or one of the travel agencies we work with, so in the case of the insurance, it's a cashless process. You don't pay, you don't need to get a receipt, you don't need to deal with the bureaucracy of sending documentation and getting reimbursed. Nothing is transparent. You just go to the doctor and that's it. So people love the solution. People actually, after we launched in 2018, the customer satisfaction was, the NPS is how we measure, was very high. Yeah. And because, you are really in a situation where you are very worried, you are very scared. And having the ability to find a doctor, to set an appointment, to go, not to taking care of payments or anything, is very reinforcing for the people.
Yeah. I've got a couple questions now that you laid it out for us. So let's talk about the business model first, then we'll talk about the clinicians that you're partnering with and how it all works. So you've got 2 essentially pathways that a patient might find themselves. Let's say, I booked through my travel agency. Is it like a rider in the travel agency's agreement, maybe, that they've got some kind of health benefit or something like that? Or how does that piece work if somebody's booking like a trip, let's say to Italy or something like that, and they get sick?
So usually, depending the travel agency, if it's a cruise or if it's a tour, organized tour, the people that organize, the tour operators will know that if someone is sick, they tell the person, look, you download this app or get in connection with this website and you can find a doctor. If you need a hospital, no, we don't deal with the hospitals. Okay. Because actually it's exactly our philosophy is that we want to provide you immediate help for minor things without the need of going to a hospital, which usually makes the experience much more difficult.
Yeah, and much less costly if you're avoiding the hospital, right?
Okay, now you go to exactly the point why the insurers wants to work with us. Because now let's say that you are an insurer and I don't know where to go. I go to the hospital says, oh, Jenny, yeah, she has an insurer behind her. Let's leave her for the night in observation. Let's do a blood test and an MRI. So I am ruining my vacation time, being at the hospital for me and my family maybe. And the insurance is paying thousands of dollars for something that could be resolved with me going to a doctor, in the community, a dermatologist, giving me something and being back in my hotel within a few hours. So the insurers' motivation to work with us is mainly that great customer experience. You don't need to pay and all what we discussed before, but also the fact that they save a significantly amount of money and their costs go down. So together, it's a win-win. The customer is very happy, but they are also saving money, avoiding people going to hospital when it's not necessary.
Yeah. Well, and I'm assuming like there's some places where health insurance even isn't a thing, right? There's universal health care that's all through the government programs, and that becomes hairy, right? If you're going from one country to another and you find yourself sick or something like that, like, is there, I guess, so the whole government payer for healthcare thing is obviously different to me because I'm here in the United States and we are basically managed through third-party payers, but there are folks out there who are on government healthcare plans. And if they leave their country to go to a neighboring country, for example, and they get sick, is that hospital billing, like, how does that whole process work? And I'm assuming your app helps obviously decrease that overall cost, because if they're going to go to a community care provider instead of a hospital, it's saving tons and tons of money. But that whole dynamic is just interesting to me.
Okay, we usually, if we work with an insurer, like we are signed with the Allianz and Ergo and different big insurers worldwide. Then if we work with them, they have their assistance company. And if it needs to be escalated, let's say that you are in US and you have, I don't know, Cigna or one of the big insurers in US, but you travel outside of US to Mexico, or you travel to France. In that case, you don't know where to go. And the insurer will tell you, go to a doctor you find and send us the invoice. But in that case, you will need, in any case, a way to get to these doctors and to get, the information. So that is something that we provide. Also take into account that the American system, the HMOs or the insurers you have locally, you have that also in Europe. In Europe, they have a European card that, let's say, French people can be treated in Italy, but only in public places, in public hospitals or public clinics, which not always are the best for the person or what they are looking for. Sometimes you prefer to go to a private doctor, your insurance will cover you anyway. Now, I think your question was, what happens if you don't have an insurance?
Yes. Yeah. What happens if you're not covered by insurance? So I don't have health insurance. I have a health share or something like that. So I'm basically a cash pay patient for most things, right?
Exactly. But you will pay. If you don't have an insurance, you will need to pay by yourself.
So it's just like a fee that you pay the doctor and you call it a day.
You pay the doctor through us. We have an arrangement with the doctor where we get a commission from the doctor because we are bringing them the private customer. We are doing the marketing for them for free. We don't ask from the doctors to pay us a membership or anything. We tell the doctor, you know what? When we bring you a customer, then we take our commission from the transaction. And they are very happy about that because these are doctors that usually don't see private customers or travelers,
Yeah.
So, and in the case you need really a hospital, so we work with assistance companies and we escalate to them. We tell you where the hospital is, and we take care. We help you as well. But mostly, if you have a health insurance in US, when you get back, you get reimbursed, mostly.
Yeah. So you get like a super bill or some itemized statement that they submit to their insurance. You get an invoice from us.
You have an invoice from us saying, this is the treatment you got, this is the pricing, what you paid and everything. You send to your insurer back home, and an insurer mostly reimburse you, depending which agreement you have, but it's 99% of the cases, they are covering you outside US as well.
Yeah. Okay. Cool deal. Yeah. Because that whole piece about like billing insurance companies from another country and all that, I'm sure gets super hairy. So it just cuts out the middleman. They pay, you give them an invoice, they submit that to their insurance company, and they can sort that out when they get home, right?
And usually, even if you are, I don't know, in Georgia and you travel to California and you're in San Francisco, and let's say you need a dentist, okay? So you have a problem to find a local doctor and setting the appointment when are they open, making phone calls. No, it's a digital solution. Everything happens online. Everything happens through the application. You send your request. The doctors may tell you, the dentist may tell you, instead of coming at 10, come at 10:15 because it's better, whatever. So everything happens online. And that's what the people today want. They don't want to deal with calling someone, making international calls or whatever. It's much easier that way.
Yeah. Yeah. They want an immediate solution. So then is there some sort of like qualifying system or quality rating system for clinicians that get in the network? Is there like a review mechanism in place, or like how are you ensuring that the clinicians who are getting on board with AirDoctor, I mean, obviously we would trust that everybody is up to par, but let's just say there are some bad actors or people that just aren't good. Like, how do you make sure that there's a baseline level of quality of the clinicians that are involved with the organization?
Yeah, okay, so that was a learning process for us. We learned over the time how to do it better and better, because at the beginning what we had was very instrumental. Like we checked the diplomas, we check the graduations, we check the everything. We also check in many countries. You can go through governmental sites where you can check that the license, that they have a valid license, and so and so. But once you went through the first part, the checking that this is really a doctor, there are some countries that it can be questionable. But once you went through that, you want to know if it's a good doctor, not only if it's a doctor. So our customers review the doctors and they rate the doctors. They rate our service, but separately they rate the doctor. And we check the bills, so we know if the doctor is, putting things that they are not need to be there. We know if there is a complaint about a doctor. We have a community of doctors department that we contact directly and we'll handle dispute. We'll talk to the customer. We'll talk to the doctor. So we had cases that we removed doctors from our database because we were not happy with how the doctor was conducting himself or herself with a patient. So there is this combination of checking the formal checking of the doctors, recommendations. There are many websites where you can read the recommendations about doctors or other doctors recommending. The second part of it is how do we get to the doctors? In each country is a little bit different. Now, after 4 years, we are in 74 countries around the world, where we have a network of doctors that we know them. And in each country, it's a little bit different. For instance, in Greece, when I did it myself to learn the process, we went through each doctor recommending another doctor, because doctors will never recommend a bad doctor. It's their name in the stake. In other countries, we went through the embassies. The American embassy, the Canadian embassy, the Israeli embassy, they have recommended doctors in their website so we started with those doctors because we know that someone else already checked them and they are good doctors. In many cases, the embassies themselves help us to contact the doctors and get to the community. And in certain countries like UK or where else, Italy, we had local people recruiting the doctors from us, people coming from the healthcare business. So it's various. So you have the recruitment of the doctors into the system. Every doctor is checked, validated in a different way. But then after the doctor is working with us, we track the performance to see that really people are happy with them or how the doctors behave.
Yeah. It seems like that's one of the big hurdles too you would have for, obviously you don't speak the language, you don't know what's going on, you're sick, you need to get better. And then it's like, wow, do we even know if this doctor is a real doctor or if they're a good doctor or anything like that? So being able to get the quality control down is I'm sure is huge for patients.
And it's depending in which country you are, because if you are, let's say in US, I will be more comfortable to go to a doctor even if I don't know it. Don't know. Frauds can be everywhere, but there are some countries you will feel a little bit more relaxed about that. But there are some other countries that you will be very, very worried about it. Okay. Doctors have agreements with the hotels, with the receptionist or the concierge at the hotel, that they get a commission from the hotel. They pay the commission to the hotel to get referrals for tourists, things like that. So what we did, we took all this out of the systems, and we are going like booking.com, Airbnb. When you take an apartment, you check the reviews, right?
Yeah.
Or you check what other people said about this place, this hotel. Today, the users are very, how I will say, very intelligent, smart, and knowledgeable users on how to find if this is good for me or not, or this is a trustable website, a trustable place.
Yeah. Well, this is exciting, interesting. So I guess if somebody's, let's say they're about to book their trip to Italy this coming summer, how do they find out about your app? I'm assuming it's on all the major, Apple Store, Google Store, wherever you download apps from, right? And it's just a smartphone app that they can log into, and it kind of takes them from there.
Yes, it's a free application. We have that in Android. So in Google Store, you have that for iPhone, in Apple Store. But you can also, you don't need to download the application. You just go to our webpage. You say book a doctor. You get into the same platform mobile for your phone. You will see and do everything online without even needing to download the application. And so everybody can get to us. If you work with an insurer, or if you have an insurance with someone that we work with, your insurers will tell you. When you buy the insurance or when you get to travel, your insurers will tell you. If you have a problem, they send you the link. And so we recognize the customer. When you come through an insurer we work with, we know who you are. We will say, the moment you open the platform, we say, hi, Rafi, how are you doing? Because we already know who you are through the insurance. We have an API with the insurance company. So we have already, we are integrated within their IT systems.
Okay.
So we can know if you have a valid insurance policy, if there are other people insured with you, if you have family and you're traveling with your wife and kids, they will be as part of your policy. We know what you're entitled to because, different insurance have different conditions. Like you can go 3 times. You can, a dentist only covers first aid until $500. Or other insurers will say, we don't cover pregnancy, or we don't cover pre-existing conditions. So all those things we developed. Now we are talking about technology a little bit. We developed the technology that when we recognize who you are and from where are you coming, who is the business behind you, we actually can offer to you what your insurer wants you to see, because it's what is covered. And if it's not covered, we will tell you. You can still use, but will not be covered by your insurance. So we develop a chunk technology, we call it, that it's a smart way. It's like a Lego. We put each insurance can choose how they build their product. and the customer will see what their own insurance supports.
Yeah. So I guess like if I do have insurance company, I enter that into your platform and it kind of, you just tell me this is what your insurance says you can go to, right?
We are going to show you exactly what your insurer says. For instance, you will see the platform like everybody else, but without pricing. You won't see the price for the doctor because your insurance is cover the pricing.
Yeah. So you'll see your copay amount or whatever it is.
Exactly. If you have an excess or a copayment, you will see your amount and you will pay it. If you don't have it, so you will see pricing. You will choose the best doctor for you, regardless of the fees. If you are not coming through an insurance, you will see it. Now, if your insurance covers the first aid dentist, you will see a pop-up saying your insurance covers this and these treatments, which are first aid. Okay, so we customize the platform for the business we are working with. In that case, and it's completely customized. Yeah. That is another advantage for the insurance company because, for instance, they want you to do, if you bought an insurance and you want to renew the insurance through the same platform, if you want to send a claim for luggage, you lost your luggage, you do everything in one place and it's digital and it's online, so makes the life for the customer easier.
Yeah, no, that's awesome. So, we're getting near the end here. So if people want to find out more about Air Doctor, about your work, about finding a doctor near them, where can they go do that?
So the easiest way is to go to Air Doctor in 2 words in your Google Store, Apple Store, or online. You write in your website and get to the application. See what you need. You will see the list of insurance we work with. So you can go through your insurance or you can go as a private customer and pay by yourself, both things. Actually, I think the nice thing from what we do is that is for doctors of the community, my dentist, my personal orthopedic doctor, and so are in the platform. These people never work with travelers. They are really good doctors from the community. So you will find those and you will set the appointment and you go to the doctor. We have a customer support 7/24, 365 days a year. And in any case, if something happened, the customer support will help you immediately. We answer through less than a minute in several languages. So we work with, if you don't have a package and you don't have a phone, you can write to us, chat, WhatsApp, many different ways. So you are never alone in the journey, which is for us the most important part of our business. The person knows that any problem, they always can contact us and we will find a medical solution, even if it's not through us. We will help the person if it's something important I forgot to tell you. During the COVID time, we realized that we need to add telemedicine because people don't want to go even to clinics, to doctors' clinics. They are afraid.
Exactly.
And we say, look, we have all these thousands of doctors around the world. So we offer our own doctors, say, do you want to do telemedicine? We will train you. We use an American vendor to train them. And now we offer telemedicine in 15 languages because we have doctors all around the world.
Yeah.
7/24. And actually, this is great in the post-corona time, where people sometimes don't want to go to a doctor, and we did it also because if you are in a remote location, let's say that you went to Machu Picchu and now you went to the Amazon jungle, you don't have a doctor there. So what do we do? And we have those situations. And so now we can tell you, okay, at least you can do telemedicine with a doctor in your own language. If you need a prescription, we connect you to a doctor that is local so he can prescribe. Which is a big advantage because if you do telemedicine with your doctor in US, but you are in, Argentine, he won't be able to give you a prescription that will be accepted there.
Yeah.
But we will connect you to a local doctor in English that can prescribe for you. So our telemedicine today, a side note, we use it with Ukrainian people. We offer for free to Ukrainian people that they are in Ukraine or refugees. We created this project. We realized that many people cannot go out of their houses to go to the doctor, and they are really under a heavy stress situation. So we offer a free telemedicine for Ukrainian people with doctors, some of them even volunteer. And we have an insurance company that is covering the medicine. So we offer also the medicines for free. Awesome. Yeah, and that's something, we are doing this because it was a need, because it's a business, but we are helping people when the persons are under very stressful situation.
Yeah.
And we feel good about what we are doing. It's not just doing something that you are doing to make money. We know for sure that we are helping people under stress situation, which I think is it's a big part of how do we feel within the company itself.
Yeah, no, that's awesome. I'm a big fan of saying that we get into healthcare primarily because it's a vocation or it's a calling, and then we just figure out how to make it work on the back end. So.
Yes, exactly. And my philosophy of management is, kind of lean management. I am in the game, in the place where the things happen. Many times I sit in the customer support and I answer myself 2 calls. And I learn what happened on the other side. When someone is sick, believe me, Rafi, you really feel bad. You really feel resourceful, and you need help, and you need someone to tell you it will be okay. We will find the doctor for you. Don't worry. Give me a minute. That simple thing is so reassured. It gives so much reassurance to the person. So it's a good feeling, bottom line, that you can help.
Yeah. All righty. Well, we'll get all of the links to the show notes and all that to Air Doctor and the app and all of that. If there's just 1 or 2 things you would want a listener to walk away with from the episode, what would they be?
Is that you are not alone when you're traveling. Don't worry. You are not alone. We are with you. When you travel, you have your passport, you have your medicines, you have everything you need. Make sure you have a doctor in your phone. And then if something happened to you, we hope not, but if something happened to you, you are not alone. It's online, it's digital, but it's a 24/7 people helping you if you need something. So I think it's a very good feeling, and we are happy to be there with you.
Awesome. Well, thanks so much, Jenny.
You're welcome, Rafi. It was a pleasure talking to you.
All right. Well, I hope you enjoyed that conversation with Jenny about Air Doctor and using technology and apps to connect travelers across the globe to local clinicians. Again, I think the idea of it, and she said this at the beginning, like it seems like such an intuitive idea, right? We use Uber to get a ride from the airport. I know I travel every now and then, and when I do that, I'm jumping on Uber. I'm not getting on I'm not looking in the yellow pages for a taxi company to call and pick me up. We use our phones for everything. If I want to find a place to eat, I'm using my cell phone. I'm Googling it. There's an app for that, right? So it only makes sense. Like, why wouldn't we use that technology or leverage that technology to increase access to care? And it really can be, depending on where you're traveling and the language spoken, it can be very overwhelming sometimes if you're in a situation that you don't know the way out of and you also don't speak the language. I have not traveled all that extensively into areas of the world where I don't speak a language, but my father's from Costa Rica. I speak Spanish, at least enough Spanish to keep myself out of trouble, right? And so this is probably 10 years ago when my wife and I got married. We went down to Costa Rica for our honeymoon, landed there in Costa Rica, and we were going to catch a ride to the hotel and then to the resort and all that. And I remember my wife feeling very out of her element and uncomfortable because she didn't speak the language and she didn't know what was going on. And, I was just talking with folks in and out of the airport, talked to somebody on the sidewalk, got myself hooked up with a taxi driver, and we kind of got in and went to the hotel, and we didn't get murdered. It was fine. But my wife was freaking out the whole time because she really didn't know what was going on. And at one point in time, she said, I remember having this conversation with her. She said, man, what would happen if you weren't here and I got sick, or, there was an accident or something like that? Like, I feel totally out of my element and totally helpless. And imagine that feeling. And then on top of that, and not just being something like, you lost your wallet or your passport, which would be a huge deal, but like someone's life is on the line potentially. It's a medical emergency, and you're going into an area where some people don't even have the medical education. Maybe they're a lawyer, an accountant, or something like that. They're very smart, but they don't have any medical background. And then on top of that, they don't speak the language. Like, that can be super, super scary, and put you in a position where you really feel helpless, right? So having some kind of tool like this, like Air Doctor, that can connect you to hopefully a clinician that speaks your language, but then also a clinician that has been vetted and that is a legitimate doctor. Depending on some places, especially traveling in Latin and Central America, like I have, there are times where it's kind of questionable whether or not this is a legitimate doctor's office or this is just somebody hanging up a shingle, right? So the fact that this company has gone through the background and the credentialing, so to speak, like they've made sure that these are legitimate clinicians, they're legitimate doctors that have graduated from medical university, and they practice and they treat patients, and they're not, swindling anybody, takes away a lot of that apprehension that you might feel or that you might have about going into that situation, going to that clinic, right? So I think it's super, super cool. I love seeing applications of technology that we already use in other parts of our lives, like Uber or something like that, being used for to increase access to care, decreasing the barrier to care, and ultimately decreasing the cost, right? Because if you go to a private clinic somewhere, you're going to save a whole lot more money, or you're going to spend less than you would if you had gone to the hospital, maybe for something like a head cold, or maybe it's a GI issue, which isn't something that necessarily you need to spend the night in the hospital for, but depending on where you're at and the location, and the language being spoken, and like Jenny said, depending on your insurance, they might go ahead and admit you and observe you and all that kind of stuff. And so anyways, it seems like a pretty cool concept. Next time I travel, I'm going to download the app and see if I can't put it to a test. So that's all we've got this week, folks. If you like the show, head on over to iTunes, leave us a rating and review. It helps people find the show. If you wanted to subscribe to the email newsletter, get a copy of the show notes and all that into your inbox, you can head on over to www.rehabilitationpracticesolutions.com. You can click the Insights tab and then the podcast box, and we'll send you an episode. We'll send you the show notes whenever we drop an episode. We do that usually every other week on Wednesdays. Sometimes there'll be a bonus interview. We haven't done any of those in a while because I've been wrapping up this book for the last year, so hoping to do a whole lot more of those in the coming year. And that's basically it for this week. So until the next time, folks, be safe, be healthy. I will talk to you then.
Thanks for listening to the Better Outcomes Show, where we explore the possibilities of a new healthcare. Our hope is that you walk away from each episode informed, equipped, and empowered to push the boundaries in your own practice or business. We want to give you the tools to help you build strong, long-lasting relationships with your patients and clients, helping meet their goals, improve their health, and achieve better outcomes. Learn more at www.rehabilitationpracticesolutions.com. We'll catch you on the next episode.